So this is a very good question. Nipple erection, inverted nipples. How common is it to lose all nipple sensation? So the word all. Now, if there is any cut around the nipple, remember there are a lot of nerve endings, ducts that feed into and around the nipple. So anyone who has had an incision placed around the nipple from 3 o'clock to 9 o'clock, even partially, you will see this is in the textbooks. Nipple sensation lost completely, partially, or maybe not at all. And no one can guarantee inability to breastfeed, not all, a small subset. Acute and chronic pain, pins and needle pain, scar tissue that will retract inward, hypopigmented white scar, hypertrophic scar. Some patients have had widening of a scar because it was under a lot of stress. And then also, very importantly, the patients, when they palpate, let's say, for example, the right side was operated, left one was not. When you palpate, you will feel inevitably scar tissue on the right side. And let's say if the left side was not touched at all, you would not feel any scar tissue, because anytime you make a cut, you leave scar tissue. So there's a lot of hurt. No one can guarantee that you are going to have it or not. And any plastic surgeon must discuss with you what are the risks of cutting around. Now, the 10% that is mentioned here is true. Now, sometimes it may be 5, it may be 25%, depending on what are the findings. And remember, when nerves are cut, some of them will come towards the surface, but we still do not know. Now, remember, it's not only the loss of sensation or minimal sensation. Sometimes it can be a painful sensation as well. And so this is something that I would say is very tricky. And in my practice, I absolutely avoid cutting in and around the nipple. Why take a chance? It's not worth it, period. Now, I myself, for example, I've taken care of patients who had an inverted nipple. Now, first on, anytime you have an inverted nipple, you have to go get tested to make sure it's not breast cancer, get the ultrasound/mammogram, just like the basic workup. And if you have tried the suction cupping technique to pull the nipple out, then the last resort is to go to a surgeon who can release it and to basically allow for you to aesthetically look optimal. And that will be something that will be very reasonable, and just releasing that scar tissue such that it's the least amount of dissection or cut in order to aesthetically allow for the presentation to be such that you're not compromised in any of those other risks of doing that procedure. I want each and every one of you to go online, YouTube, and to see what and how, when a nipple is cut, what exactly it entails and what the extent of the surgery is. Because overall, I find anytime you operate, it's a very involved process, and certainly around the nipple where you have a lot of nerves and ducts and whatnot else that indeed can occur. This is Dr. Khan, Executive Plastic Surgery.